A nipple shield is a silicone piece that fits over a mother's nipple to help babies who are struggling with breastfeeding. It provides a firm stimulus at the roof of the baby's mouth to help them suckle effectively, and has holes to allow milk flow. Nipple shields are meant to be a short-term solution to help teach your baby to latch during breastfeeding. You can get a nipple shield at retail stores, hospitals, through private insurance or Medicaid, or federal programs like WIC. Never buy a used nipple shield, as this could expose you and your baby to contaminants. Nipple shields can be helpful if your baby is having trouble breastfeeding, if you have flat or inverted nipples, if your breasts are very soft, if your baby was born prematurely, or if your baby needs an extra prompt to start sucking. Do not use a nipple shield until your milk comes in, usually within the first 2 to 6 days of the baby's birth. To use a nipple shield, follow the instructions on the packaging. This typically includes warming the shield in water, rubbing a little breast milk on the inside, stretching the brim and pressing down the edges, creating a small gap between your nipple and the shield, and positioning it correctly for your baby's nose and chin. A lactation specialist can help you learn how to use nipple shields. Breastfeeding takes time and practice, and if you're struggling, it's okay to ask for help. The most important thing is that your baby gets fed, and nipple shields can be a temporary solution to help with breastfeeding. Nipple shields can be really helpful for mothers who are breastfeeding, but they also have their pros and cons. Advantages of using a nipple shield. If you have flat or inverted nipples, a nipple shield can help your baby latch on easier because it provides a larger area to latch onto. For premature babies, a nipple shield can create suction and position the nipple in a way that helps them breastfeed, and it allows them to pause and breathe without having to reposition. You can usually stop using the nipple shield once your baby gets stronger. Disadvantages of using a nipple shield. A nipple shield cannot fix underlying issues like damaged nipples or low milk production. Even with a nipple shield, you and your baby will still need to learn how to breastfeed. Using a nipple shield may cause pain or damage to the mother's nipple if the baby latches on too tightly. Sometimes it can be difficult to stop using a nipple shield. If you're having trouble with using a nipple shield, a lactation specialist can help you figure out what will work best for you and your baby.